COVID-19 has changed our community forever. In the face of an unthinkable infectious enemy, our health systems and healthcare providers adapted to meet the changing needs of patients. In recognition of these efforts, we asked several local leaders to reflect on their journeys over the last 18 months and how the pandemic continues to shape healthcare in our region.
So COVID-19 dramatically changed healthcare delivery. Mercy was already a leader in virtual care, but it really accelerated our adoption of virtual care. In fact, in the first 10 months of the pandemic, we did over 80,000 video visits and over 600,000 telephone visits. So we rapidly shifted to more of a virtual platform to care for all those patients in need that still needed care despite being in their home or trapped in their home.
A second way was in forging partnerships across the region among healthcare providers, the public health departments, and other stakeholders. We had a need to bring these groups together to align how we were going to tackle the pandemic locally, and it really served us well. I think it'll serve as a model going forward as well. Examples were standardizing policies. Many things that the health system needed to do were not things that were easily done, and it was much better for us to do them in concert, such as visitor policies or management protocols.
This pandemic has also highlighted major gaps in healthcare, especially with chronic disease management. Unfortunately, many people opted to delay healthcare during the pandemic, and this underutilization of chronic care management is now contributing to rising healthcare costs and leading to increased health complications. To respond, the healthcare industry is having to be more innovative than ever to meet the needs of all people seeking healthcare, and most importantly, for those who have delayed healthcare.
It certainly validated that infection prevention is important. Certainly made us look at our staffing and employee retention and how can we take care of our employees better because they were under tremendous stress. And then how can we communicate better with the public as well and with the communities, and how can we partner with a lot of people that we typically had not partnered as much with.
COVID catalyzed a lot of changes inside BJC. We really had to find ways to make it more efficient and more effective to take care of the populations as COVID was superimposed on all the regular healthcare needs that the region had. Some examples are Patient Transfer Center and Central Staffing Office. The Patient Transfer Center really enabled us to move patients efficiently within BJC and from outside BJC to make sure we optimize the use of the available hospital beds. The Central Staffing Office, on the other hand, allowed us to flex individuals between hospitals to take care of patients. That way we could move staff members to locations that were in need of support, and we could move patients to areas that had open beds.
We became much closer together as healthcare systems, as well as with our partners in public health and the business community and our governmental officials. And I think that's really sort of the biggest blessing to come out of all of this, if there is a blessing in a pandemic, is we began having relationships and tighter relationships and working together more so than we ever had before. And when you put that those different perspectives and a lot of smart people in the room to work on a common problem, you can do a lot of good for the community.
So I think the most impactful change that the pandemic has taught us is really that we need to treat all patients in the community. So if you only take care of a portion of the community, that disease can still spread to others. And so with infectious disease pandemics, it's a great lesson that we have to take care of our entire community. And Mercy's already been committed to that, but it reinforced our need to be essential in every aspect of the community health. So we've accelerated our efforts in community health, in outreach, in virtual care, even though we were leaders before that, to even doing more virtual visits, home visits, and things like that to keep people healthy.
So the pandemic really changed how we deliver healthcare. We had to become more nimble, we had to become more focused on the patient. The idea of having a frictionless delivery of healthcare to the patient became really important. Being able to reach with the patient into their experience was of utmost importance to us. The patient really required a lot more intensive, personalized care than they had ever needed delivered before. This was just such a tremendous both challenge and an opportunity for us as an organization.
As the pandemic winds down, which it inevitably will, there are really a number of things we need to do. First and foremost, we need to get people vaccinated. Our only chance of preventing serious future surges of coronavirus infections is to get the immunity levels in the population up to a higher degree. So vaccination is our gateway to do that. There's also the need for us to think a little bit differently about how we manage businesses and population health during these periods. I think masking may become a more common phenomena when there's a flu epidemic or there's another virus circulating. And I think we really need to think very hard about policies in businesses and other places about how we manage people who are sick. We need to move towards policies that encourage people to stay away from the office, maybe more sick days, other mechanisms that we can avoid accelerating spread of diseases that may cause greater harm and damage.
Vaccination is key to continue for all infectious diseases, the ones we know about and the ones that are emerging. But it also shows us the value of preventative health care. And so keeping people healthy before they get infected will also help their outcomes if they do get infected. But the keys really are vaccination and masking with these infectious pandemics. But it just shows you the value of keeping people well and keeping people healthy versus treating the illnesses. And so at Mercy, we're really focused on wellness.
What I would really like for employers and our business community to do now, as well as in the future when other epidemics and healthcare crises occur, and that is to somehow depolarize or depoliticize healthcare. I don't know how it came about that for significant segments of our economy, having vaccinations and wearing masks and doing the usual efforts to prevent infection has become a political agenda. And that's been so discouraging for us in the healthcare environment. And that's what we could really use the business community to help. And that is to ensure science and support our public health educators and public health institutions in our state and the nation.
So I think as individuals, whatever we can do to stay as healthy as we possibly can, whether that is, proper diet, exercising, regularly seeing your healthcare provider, all of those different things generally make you, more resilient to not just to a respiratory disease like COVID, but to any disease. From a community level, I think reflecting back on that previous discussion about bringing people together to work on a common problem. So there's other things that can in the community outside of healthcare. And so that's things like education and housing and wages and all of these different things have much broader impact on health overall. And so engaging with different partners so that we can start reducing poverty and improving education levels and all of those things really do, you don't see it, but they really do have a direct impact on the health in the community. And that makes the community more resilient for whether it's COVID-19, whether it's diabetes and heart disease, or even natural disaster.
It is with our deepest appreciation that we recognize the healthcare heroes in our community. Thank you for your service. It is because of you that we emerge on the other side of this pandemic, more resilient and ready for the future.